without further ado, U.S. Senator Mark Begich, come on up to the stage. Let's give him a round of applause. Thank you.
DJ, thank you very much for the invitation. I look forward to it. Just to give you a sense of the day, I started at, I can't remember, I think 4:30 this morning. I was in Bethel an hour ago. And I'm here, but I'm thinking of caffeine. I don't drink caffeine. I never drank coffee, and I've stopped drinking soda and sugar drinks, but I'm just like on a temptation right now. But then I'm here at a health conference. It's not healthy, but I'm glad you have them. So thank you very much. Thanks for the opportunity to be here. Thanks for, I know, DJ, we'll have a couple questions here we'll do, but I'm looking forward to that and the opportunity. I want to give you, and I know you've had a long period of time already talking about these issues which are important, healthcare and healthcare, the state of reform and what's been happening or not happening. And I'm happy to talk about this and the fixes that we're trying to do in Washington, give you kind of an update and kind of where it will be in the future and where it is today. We have to think about, and I always remind people, where did we come from, where were we before we got to the point of reform, and then where are we today? And when you look at the outcome, we're at double-digit plus premium increases were the norm for every year, every type of policy, every kind of program. Insurance companies could deny coverage based on pre-existing conditions or cancel coverage just because of an illness. And 1/3 of Alaskans who wanted to purchase insurance in the individual markets were denied in Alaska. Today, the net number is 0 because they get access no matter what. This is progress. No matter, and I can say this because the way you introduced me, because you invited my opponent, despite what my opponent likes to say every day, it is progress. Is it perfect? No. Is there more opportunity ahead of us? Absolutely. When I look at the coverage, and when I talk to people all around the state, and I travel quite a bit, I run into people time and time again that tell me and thank Congress for at least allowing access for people who had never had access before. A small business owner in Fairbanks hadn't had coverage for 10 years. 10 years. Someone just recently I talked to got coverage for the first time. She was off coverage for about 3-4 years, and she got coverage. She went in for the preventive, and now she has breast cancer. She didn't know it, but she's covered. And she knows she caught it early enough that she can hopefully manage it to the right end degree. Or when I travel around and I go to coastal communities and I run into fishermen all the time that could never or barely could get coverage. And when they did, it was very, very expensive, it was mostly catastrophic. And they basically made the comment that they don't know what it will cover, but maybe as they're close to the end of their life, it might cover something. But in reality, what they wanted was really how to prevent their health to deteriorate and how to improve it. And I see that all the time. As I said, the act isn't perfect, but let me be very clear about this. People who, and my opponent and others, who talk about repeal means a couple things will happen. The 13,000 Alaskans who I've actually helped navigate, I don't know if anyone's in here navigators or done it. I've done it. I've navigated on the website for people, got them signed up. 13,000 Alaskans overnight will lose their policies when you repeal because the marketplace will go away. On top of that, another side issue, in this law, the permanent reauthorization of the Indian Health Care Act is in there. After waiting 17 years for it to be reauthorized, it's in this bill. It's permanently reauthorized. It will go away and we'll be back into uncertainty with our Indian health care programs. Now, as I said, it's not perfect, and there's things we have to constantly do. One of I believe, and I've been working to fix it wherever I can, whatever piece I can, and I'm not, people who know me and have been working with me, I'm not shy to tell people where these fixes need to happen, all the way to the president on down. When that website was all messed up, I got on that website 12:01 October 1st. 12:01. Why did I do that? Not to determine if it was going to be a problem, but how bad, because of things I already had sensed in the preparation of it. And I've delivered those messages to the White House on down on the things we need to fix. But one of the important fixes I think needs to happen is a legislative fix that I've suggested called the copper plan. The copper plan, as we know, where there's bronze and silver and gold and platinum, the copper plan is designed to give a new level of health care coverage. Independent groups have already determined that the copper plan can save a consumer around 18% on their premium costs. They also found that most people who would sign up for the copper plan are currently uninsured, meaning we'd have more people in the pool. And as you know, if you grow the pool, what happens? You start stabilizing pricing, and you create more opportunity for choice. It's important that we create this opportunity, I believe, and I call it catastrophic plus. These are people who want to buy potentially a catastrophic plan, but they want the same consumer protections that ACA offers, and at the same time making sure they have the coverage they will need as time moves on and as maybe they then graduate up from a copper to a bronze and so forth. We know having this option to purchase, it would be a lower value plans makes sense in Alaska marketplace. There's no question about it. Alaskans will have a choice to pay a lower premium up front if they're willing to pay more out of pocket. More in line with plans they were offered in Alaska before ACA, but again, protecting the consumer protection component and the preventive care that is necessary and important for folks to have. I believe the idea, because I've talked to Republicans about this, I believe it has bipartisan support. The problem is when there's toxic political environment. No one wants to solve problems, they just want to politicize them because it makes good hay and good campaigning. I can tell you that. I see what they do to me every day. But on this issue, it is good politics to fight on this issue. It's bad public policy because we need to resolve these issues. Just in the copper plan alone, it is estimated to save taxpayers $6 billion and add to cutting the deficit by another $300 million. And has generated support from industry, business groups, and others because it gives another choice to the consumer as they decide what kind of health policies and plans they want. The Secretary of Health and Human Services has announced that they're going to review this copper plan, especially in tight, smaller markets like here in Alaska, because we need more choice. And this is one option that's out there. The Affordable Care Act doesn't just impact individuals and families, it also impacts businesses. I can tell you this as a small business owner. My wife is a small business owner employing 30-some people. As a small business owner, we understand these challenges that we want to offer. It's one of the best tools for small businesses. If you are a small business person, 15 under, right now the law says you don't have to provide, but you want to, or at least give some options, because that's how you retain your employees. Otherwise, mid-sized large companies steal them from you because they will offer them health care, which is a high demand. You can pay them less, but if you give them health care, it's a high value. Big companies can pay them less, but give them health care, they will move to them. This is an important asset for small businesses. In addition to the copper plan, I've introduced legislation to go after increasing these incentives because in the original ACA, they weren't enough. Some of us in the small business world knew this. And the efforts to get the plan done, there was limitations that had started to occur when we got it to the floor, what we could add to it or not to it. So we know in order to enhance or increase capacity for small businesses, we have to increase those tax credits and give them more flexibility in how to use them and larger groups. We also have led some efforts already to clean up some of the messes within the law. The 1099 requirement, people may not be aware of this, and lucky you weren't if you were not aware of it. In the law, as a revenue producer, there was this small IRS clause to have this additional paperwork thrust upon small businesses called the 1099 form for goods purchases. This would have meant an enormous amount of paperwork for small businesses, unrelated to health care. It was just a revenue generator. I worked across party lines and we eliminated it, got rid of it. And the reason is because it would have no redeeming value at all in the sense of delivering health care, so we got rid of it. We've also made some improvements in the law, such as making sure survivors of domestic violence can go and access subsidies on the site, on the marketplace. Also protecting our volunteer fire departments from unfair penalties. These are what I consider common sense ideas. Common sense ideas that there are many people out there that are creating them, not only from the Congress, but other people are bringing ideas of how to tweak certain things, how to improve it. Again, the challenge is we have people who just say, let's repeal it, and somehow magically healthcare would just be there for everyone. That's not going to happen. Politically, how hard it will be to repeal is, and this is what I say on the campaign trail, I say, look, even if you get a Republican majority in the Senate, the president is there for 2 more years, gone in 2, he'll be gone, but he's not going to allow a repeal. So why not work to fix these things that both sides want to do? But one side won't do it because it's politically not advantageous, at least for the next 30 days. You know, when you look at on this issue, and you make sure, as I mentioned, these preventive and these other issues, we have to make sure, and I know there's a difference of opinion sometimes on one side or another on this, but it's just so important to make sure wellness and mental health and substance abuse and all these things are part of how we deliver health care in this system, because you can't ignore that. You know, we brought mental health up into parity into ACA. We still have work and room that we have to improve on how to make that reality. But just the fact that it's parity is going to have some impact. I met with a group of mental health providers in Fairbanks last week, and they greatly appreciate finally it's on parity. But there are some ways and some challenges to make it actually work. There's definition issues of what is delivery of service on mental health. How do insurance companies interpret it? Is it the same as how Medicaid or other organizations interpret it? There's some disagreement. So we have to make that work at the end of the day. The Affordable Care Act is and still will continue to be a crucial step toward focusing on prevention and wellness as well as mental health and behavioral health. There's still some other things we need to do, in this state especially, to expand Medicaid for what's available for 30, 40,000, some say as low as 12,000. Either way you count it, thousands of Alaskans could access additional health care if we expanded Medicaid. And also, if you expanded Medicaid, you would increase the pool. You'd also cut the cost of uncollectibles in the hospitals. You increase the pool. You can do some innovative things like Arkansas has done. You have a new pool of resource that you can tap into if you had the political cooperation that's necessary. So what's happened in D.C., to be frank with you, has bled into our state politics here in the wrong way. I mean, Arkansas has figured out their increase on their overall insurance policy is about 2-3%, because they figured out how to be innovative, how to use this new resource of Medicaid expansion, the marketplace, Democrats and Republicans working together. That's what we have to think about on these expansions and these other issues we have to work on when it comes to health care. Let me just end on a couple other things, and then, DJ, we can have a conversation, if that's okay. When we think of mental health services, it's one reason why I introduced the mental health first aid training program. We've been doing elements of it here already and somewhat successful. But on the federal level, I believe we need to have some more resources. As a member of the Appropriations Committee, we've been able to add $15 million to this effort for the last 2 years. This is new money, new resources to help us train our education, folks in education and public safety, how to deal with individuals that are dealing with a mental health illness, and how to manage that in a way that they, as the public safety individuals, aren't creating a violent situation where they could maybe bring it down a notch or two. How to manage and ensure that that individual who has that illness is managed in a way that doesn't cause an end to their life, to be very frank with you. That's an important piece. We also, the training is critical because it helps you understand risk factors, warning signs, and it's something that I know and I've seen it work successfully, but we need to have some resources to it. During the healthcare debate, another thing that I worked on and championed is expanding the financial support to our providers through the National Health Services Corps. This is important, and it's an important provision within the ACA. For example, another thing that has been now proposed, and I believe has opportunity if we just get past the political infighting. I've sponsored legislation to increase Medicare reimbursements for physicians to better align with Medicaid payments. it seems it's so goofy. We have everything from VA, Medicaid, Indian Health Services, Medicare, several other things. Nothing is really aligned. And part of this process is try to align this so it's a better delivery system. Because the better the delivery system, who's the winner out of this? It's the patient. The patient becomes the winner at the end of the day. Last month, Alaska was awarded $5 million from the Affordable Care Act to support community health centers. I am a big fan of community health centers. I actually run into small business people all the time who are trying to figure out they can't afford health care, but they want to do something for their employees. So I try to get them hooked up with federally qualified clinics because of sliding scale and many other assets they have. It's amazing how many small business owners, people who employ 2, 3, 4, 5 people, have no clue they have that facility in their city or their town. They have no idea, right here in our state. Matter of fact, I had a guy I was meeting with, his office, his business was 3 blocks away from the Anchorage Neighborhood Health Center, which he drove past every day to work. He had no idea what it was. And I said, this is an opportunity to have your employees work on a sliding scale based on their insurance coverage and other things. He had no idea this existed. And then he ranted about the Affordable Care Act, and I explained to him, well, this is why they can work on a sliding scale and our commitments and what we do to help support these facilities. Also, Alaska received another $1 million in community prevention grants. These funds were provided by the Prevention and the Public Health Fund in, again, the Affordable Care Act. The Affordable Care Act has multiple funding sources that are now starting to evolve and investing in our community at many different levels. So when you hear people say, we're going to repeal it, what that means is the support that I just listed goes away. It's gone. The money that helped finish the Anchorage Neighborhood Health Clinic just down the street wouldn't have been there. There were several $1 million available through a fund. So all that is important to the long-term value. And as I was walking in and talking to someone, I said, I know more about healthcare than I ever thought I would know, sitting here today. If you asked me 6 years ago, I said, I care about getting rid of pre-existing condition denials and expanding care for kids up to the age of 26 and making sure we close the donut hole, making sure women no longer pay a differential in their premiums. All these were things that I remember talking about. But since then, I've been engaged in many different levels because it is a fundamental, I can tell you this from a personal experience, 2 personal experiences. I own apartments and my mother owns apartments and most of our tenants are moderate to low income. The number one thing that shows up in their credit report is, guess what? Healthcare costs that they didn't pay. To the hospitals that might be represented here, I can tell you a lot of them that didn't pay. They couldn't afford to. But they went to the emergency room because they had to. Sick kid, or they were at a point now where they needed the care. So that cost just increased because when they don't pay it, it goes into the system and someone pays it. This is the most amazing part of this equation when I talk to people about this. They say, well, that cost we don't have to worry about. No, there's no free money. Someone is going to pay that cost. Second to this is my wife and I were one of those. We could only afford, as small business owners, catastrophic care. So when Jacob was born, we had no maternity coverage, 0. We were very fortunate that Jacob didn't have complications, but still was a $12,000 bill. We couldn't pay the $12,000 bill. We had to pay it over time. I mean, everyone is touched at some point in their life, even the people who are the most adamantly against Affordable Care Act, or Obamacare, whatever they want to wrap around it because they're mad about other things. The fact is, everyone at some point in their life is going to be touched. And the reality is, everyone in their life, at some point, the rest of the community will be taken care of. Because that's the way the system works. Medicare. We all pay into it. So even the person that comes up to me, which I experienced yesterday, matter in hell at me about it, I looked at them and they were probably in their mid-50s. And I said, at some point in your life, the rest of your community will be paying your bill. And that's a fact. So collectively, we have to resolve this issue and solve it and improve it, make it better for this generation, the next generation, and the generation to come. Making it a political football only puts people at risk. The thousands that can't get Medicaid today because of one person. The folks that are unwilling to compromise in Congress because they want to make it a political initiative for the next remaining 30 days of a campaign. People who lose in this are not the politicians. It's the folks who need the care. Those folks that I see at my apartments, or the individual who comes to me at a small town and says to me, thank you for having me get some coverage because I can finally get my prescription drugs that I need to manage my diabetes. I mean, this is the kind of things that I hear every single day. These are real. These are real people. But reform is nothing that happens overnight. Is the bill perfect? No. Have we already made important and some significant changes? Yes. Do we need to do more? Absolutely. To make it better for everybody. Will the system be smooth and clean by tomorrow? No. Will it be over time? More than likely. Will there still be ups and downs in the rate structures and everything as we adjust this new system? Yes. But collectively as a society, we have to do this better. We can't go back to the days when 34% of Alaskans who had tried to get individual policies were denied. Because sooner or later, someone will pay that bill. Thank you very much. Thanks for allowing me to say a few words. Thanks.
So how's the campaign going for you?
It is busy, as you can imagine. I spent, yesterday was probably a 20-hour day. Today we'll finish out late this evening, about a 19-hour day. Out talking to voters, talking about their issues, and not waiting for them to show up. I'm going to where they are. And Alaskans who know me know I will go anywhere. If there's one person breathing, maybe not even breathing, I will show up and talk to them about whatever they want to talk about. I will travel the state. But it's a rough road. This race will be a 1% race at the end of the day.
Yeah.
This will be a 1% margin to determine what happens in this U.S. Senate race. And the challenge is, the amount of third-party ads are pretty significant. Most Alaskans are not familiar with what's happening now. They know what's happening, but this has not been the norm of the past. There's so many ads that are now coming on the air on every subject matter you can imagine. And we have to push back when we can and then focus on our issue. But it's a campaign that I'm very positive about where we're headed. We know it's going to be tough all the way to the end, and we just got to get to the finish line and at the same time make sure our voters turn out.
I tell folks that the job is so tough, even as a sitting U.S. Senator, great job, I'm sure, but so tough that you really have to be passionate about it to get out of bed every day to do the job, because it ain't easy. But Congress seems like a place where good people go to get chewed up right now, because it just seems so dysfunctional. So what gets you out of bed every day to do a great job in a really dysfunctional place?
It's like you can almost describe it sometimes. You feel like it's a meat grinder. You get in there and you hope you don't go all the way through it. You just maybe touch your toe and get out as quickly as possible, and then try to do something good every day. I'll tell you what motivates me. Every day when I'm out and about, and like today, I think I have 3 or 4 more events before I leave, after I leave here, and who knows what I'll add to it, because I impromptu will add stuff. But every day I meet everyday Alaskans who tell me stories about what we have done to improve their lives and what they're hoping we will do. I can tell you, and I wish someday I got to write all these down, but I was in Fairbanks last week. I'm at an event. This young woman comes up to me. She's at the university. She comes up to me, and it's kind of those surreal moments where you're sitting there and she's talking to you, and there's other people kind of around and wanting to come over. And she looks right at me and says, I just wanted to meet you because, and you got to imagine she's probably 20, 21 maybe, and that's how, high school or a college student. She says, I want to just thank you because you saved our house from foreclosure 6 years ago. And I remember the call, and not from her, obviously, but from her dad, because she said, my dad called your office and you called him. And this is a person who lived in Eagle River, and they were under enormous stress, and they were not getting a response from the bank. And we intervened to try to see if we can get some response. Today, they live in a house. She's off going to college, When I run into someone who, I was out at another event, and this woman showed up with her daughter, probably mid-teens, And she came up, and it was another event unrelated to what she was about to talk to me about. But she knew I was in town, and she knew where I was going to be, so she searched me out, came to the event, came right over to me, and then said, "Thank you for helping us." I said, "Well, I wasn't sure." And she described, she says, "You intervened on an issue where our retirement system," she was a federal worker, and there was a group of federal workers being mistreated on their retirement system. We intervened to make sure it was fair. She said, "I was about to be living on a couch until you came along and made the difference." I can tell you story after story like that, and it's real. And so every day I get up thinking about those individuals, but also about what we can do to improve the system of where we live in. People who wake up every day, and I see them because I serve with some of them, to be frank with you, who wake up about how bad everything is, how the sky is falling, the world's ending. You know, are there a lot of challenges in this country, in this world? Yes. But as leaders, part of our job is to inspire and create hope for people, that we know that there is a tough day today, but tomorrow's going to be better. And we got to keep plowing through it, finding those challenges, and never looking back like it's a failure, whatever we do, but finding those opportunities to solve problems. And I believe between my work in public service, my small business work, and many other things, that I think I bring that level of energy and optimism that is critical in these times. And I think when I wake up in the morning, I think about those things.
Yeah.
And my staff knows I love being out with people because it energizes me and gives me that moment of thinking, that's why we're doing this work. This is what we do every day. No matter how many times they beat me over the head, this is why we do it. It's that small business owner now has insurance. It's that fisherman down in Petersburg that I met with his wife that said, "Thank you, I can now get coverage." It's the woman who now is covered because she now knows she's found out she has breast cancer but caught it early enough. I mean, it's that's what we do. And I think we get confused between politics and public service. I believe in public service. Politics is what the noise is that everyone hears. But public service is about delivering services and trying to do the best you can every single day, no matter how much conflict there is, dysfunctional. I mean, in a lot of ways.
Yeah.
Washington has such a high level of it. But I weave through it and try to find, I've sponsored more legislation with Republicans than probably most senators, because I don't care who's the sponsor. I just care about, do they want to get things done?
Yeah. Well, so navigating that aisle back and forth ain't easy. And you folks here know that we're policy agnostic. We don't pick content, or bills or promoting that stuff, and we're nonpartisan. But if I could stretch that a little bit, it sure seems, from a relatively attempting to be objective view, that the House Republicans and the Senate Republicans have not extended very far beyond the talking point of repeal and replace. The House Republicans said they'd come up with a replacement plan, and they shelved that, particularly after Eric Cantor lost his primary. And Dan Sullivan was gracious and provided an interview with us, which we'll release here in 2 weeks. But there is not a lot of guts in the replace mantra, right? So how, as somebody who's looking to work across the aisle, how do you sort of deal with really a vacuum of ideas on, among Republicans? That's not to be partisan, and it may sound, but right. I just think factually there's not a lot coming out there.
Well, I think
at the federal level.
Yeah, I think part of it is you have to honestly get past these elections. And you have to change, this may sound odd, but how elections are run. Because if they're going to be run every time an election is over, then you start again, you can't get the policy. You're going to get to these talking points of repeal or Obamacare. They say Obamacare. They don't even say what it is. They just say that because the president has such low ratings. It's Obama earthquake, Obamacare, Obama pothole, whatever it is, they just say it because that's easier. It's a great, applause line in certain groups. But public service is about trying to solve problems. And I think what you have to do is find those few that are there and then grab them into your discussion of these issues. And if it means that they need to take the ownership of it, fine, I don't care. I've done that in many pieces of legislation where I don't need to be the top lead on it. I just want to get it done. And that's a challenge because after these elections, they become very hardened. People, I've seen plenty of ads against me already, and I've seen my colleagues, as well as my current colleague, running stuff against me. Does that bother me in a campaign? Yeah. But does it bother me after the campaign? No. Because at the end of the day, we got to figure this out. And we better sit down, because as a country, if this is all we're going to do is campaign to campaign to campaign and never get on with policy, there will be a crop of people that are there that will leave. They will not stay there.
Yeah.
Then it will become a place where food fights occur all day long. And if you think Congress has a low rating now of 13 points, it'll be like 5. And that'll be on a good day. Because people are frustrated with Washington. They want things done. And it doesn't, I've sponsored stuff with Rand Paul to Bernie Sanders and everything in between, because my job is, if you care about what I care about, then we're going to work together. And I did a bill with Senator Inhofe from Oklahoma, very conservative on aviation. He's wrong 100% on climate change. He and I disagree on that. But we found common ground on aviation. And we worked out a bill and we passed it.
Yeah.
But but what people do, they get their personalities all mixed into it.
Yeah.
And as long as I wake up in the morning, and I'm breathing, and my wife and son are there, the rest is a piece of cake. I don't really worry about what they think about me.
So what about the Alaska residents, to flip the tables? And I sort of stuck it gently to Republicans. What about Alaskans that say, Senator, I liked you as mayor, I liked your dad, but I really don't like Harry Reid. It's not about you, Senator, it's about Harry Reid. How do you respond?
Well, it's really, they don't even necessarily say that. They say, we don't like Obama.
Yeah.
And here's my response to that. First off, he's only here for another 2 years. That's it. You can't shortchange Alaska for a desire to penalize because you have issues about Obama. And the reality is, he's just here 2 years. His term ends. When I think about an Alaska perspective, I can just be a little nitty-gritty here. I sit on appropriations. Lisa Murkowski sits on appropriation. She's a Republican, I'm a Democrat, from the same state. That's rare, to have both from the same state. But I'll tell you what's even more rare, because it's never happened in the history of the country, to have two from the same party, from the same state, on appropriations. That will never happen. Has never happened. So when you think about this, what's at risk for Alaska with a small delegation? 50% of our power on appropriations, gone overnight.
Yeah.
So you may be mad at Obama, don't worry, he's gone in 2 years. But let's not give up what we have for short-term anger over someone that may have issues that you have issues with. I mean, this is, I wouldn't put a test out here to this group, but I would bet you a lot of people in this room especially understand the power of appropriations. Because if it was true that, oh, Mark, you must be giving us a fable, then when Ted Stevens was on appropriations for all those years, you don't think he would have had his second Alaska Republican on there? Couldn't do it. It's not allowed. It's never been done in the history of the country. And it ain't ever going to happen in the future. So we have something very unique and powerful. And for a small delegation where seniority and position helps deliver for a state. Just in the last 6 years, $35 billion to the state of Alaska through grants, loans, and other things from the federal government. Previous 6 years, before I got elected, $35 billion. Even in this downturn budget, an economy in recession, we held our own. That is a reflection of having a Democrat and Republican, especially on the Appropriations Committee.
Yeah.
That's an amazing, so when people say that, it's not even Harry, they don't even, it's Obama. And I say, he's gone in two. Let's think about Alaska long term, because it's not about him, it's about what's good for Alaska. But I understand the talking point is simple and easy.
Simple and easy is seldom correct, right?
Right.
If that were the case, the Affordable Care Act would probably be 1 page long.
Right.
So as we draw closer to a conclusion, let me sort of bring it back to healthcare for a second. You've been out on this. You're here with us today. You've got a TV commercial running on healthcare now. A lot of folks say, boy, be quiet. You're standing by maybe not necessarily in Alaska, but nationwide, some people argue Democrats should not run on the Affordable Care Act. You're clearly standing by your vote, standing by your word. Turns out a lot of Democrats who have run on it, like Patty Murray a couple of years ago in a tough climate, she won. Democrats nationwide have often won standing by their vote. If you could encapsulate, and we've heard you talk a lot today, but if you could leave the healthcare community with one message about the values and priorities you bring to healthcare and will bring in your next term, what would that sort of value, message, or vision to the healthcare community be about how you will approach healthcare in your second term?
I think you would see me as I've always been, practical, solution finder, not afraid to sit down with both sides and figure out where the path is to get things moving forward with the first and foremost goal, delivering accessible health care to all Americans, no matter where they live and who they are. And I will be persistent. And I'll give you an example of persistence. 6 years ago, I campaigned on the issue of the Heroes Health Card for veterans. All I wanted was veterans to be able to, in Alaska, access our tribal health care facilities anywhere in the state, because they weren't allowed to. They had to fly to Anchorage or Seattle to get health care. And I remember the memo I got from the agencies. They had said, long memo, basically said no. And the way I looked at it is they just spelled yes wrong. They used 2 letters. I want to show them how to use 3. And I was persistent. Today, veterans can access health care anywhere in this state through our tribal clinics. And as a matter of fact, I don't know if Doug is still in the room here. I don't know. Your number is close to 1,000 now that go to your facility. These are veterans who can get same-day care, go to their facility unless it's major medical. And we didn't do this when the crisis occurred. We started this 2.5 years ago because we saw the problem, and I was persistent. I refused to hear from the Secretary of VA and the Secretary of Health and Human Services telling me it can't be done. Today, we deliver health care from the farthest places, the most remote areas in Alaska through our tribal consortium for veterans who are native and non-native, and the VA reimburses the system for that care. We are now in the model, in the baseline of the healthcare reform for veterans because of our example. So what you get from me is no matter how daunting the challenge is, how big the problem is, I will take it on. Even when people tell me, don't do it, there's no political value, you'll be spending a lot of time on it, I will take it on, fight hard, bring people together, never look about what party they're from or what their persuasion is or whatever it is, but focused on solutions. And the VA healthcare is an example of how you can make things happen if you just are persistent and you have practical solutions and you don't deviate from saying, well, I'm only a Democrat, so I must work with Democrats, or vice versa, Republican only working with Republicans. I think that's what the healthcare providers and others who are connected with it here should recognize with me, that no matter what the challenge is, how small the problem is or how big the problem is, I will know the details because I will get into it. I will understand it, I will work it, and I will tell from the president on down what I think without hesitation. And they know it.
Senator Begich, thank you so much for coming. Really
Thank you.
appreciate it. Let's give him a round of applause.